You're watching City Channel 4, your window to our community.
Pleased tonight to have Stephen Treves on my immediate left and Brad Jacobson. They're both from what has been used to be the Community Mental Health Center, but now is renamed. I wrote it down so I don't blow the title. The Abbey Center for Community Mental Health in Iowa City. Okay. Stephen's the project director, and Brad is the director of the Integrated Health Home Service. Is that close enough? Perfect. Okay, thanks. And they brought some handouts that we'll be distributing here, and so thank you both for being here. I'll turn it over to you.
Good deal. Thanks. We've practiced long and hard, so this is going to work like synchronized swimming, right?
Sure.
We've spent days working on this presentation, so we're going to go kind of back and forth. Do want to appreciate the invitation to come and talk, see a lot of familiar faces, especially Greg back there. What I wanted to talk a little bit about was, as Todd said, Community Mental Health Center for Mideastern Iowa has gone through some dramatic changes over the past couple months. Wanted to fill you in a little bit on that, and then wanted Brad to talk about some of the new programs that Integrated Health Home has put together, and then just kind of be open for questions. I think many of you have heard me speak before, and how I always like to start these things out is, what would you like us to talk about? Because I know Brad can yammer on forever and ever, particularly when there's a microphone in front of him, and we really need to curtail this because I need to get home. I tease, that's more about me than Brad. So before we get started, are there any specific things, either about the center, behavioral health care in general, about Mary?
Sure can make. So
a little more? Okay. All right. Anything you'd like us to talk about?
What happened with the merger with the administrative setup?
Okay.
And can clients now go to either place? Or you?
Okay. I think I can get both of those. Other ones? Yes, ma'am.
I don't actually know enough to tell you what to talk about. So if you just do a nice overview,
yeah.
that would be perfect.
We can do that. You think so?
Yep.
Okay,
Yep,
we can do
definitely.
that. All right. Well, let's get started and jump in. If things aren't making sense, and I'll try to make sense. As many of you know, Mideastern Community Mental Health Center is 45 years old. We were down on the corner of College and Van Buren for 40 years in 4 buildings down there. And as the board and as the management staff looked forward to what was happening in healthcare, what was happening in behavioral health care, what was just happening in the world, we began to see ourselves as probably an agency that was just too small really to be viable as the world went forward. As we saw managed care coming, as we saw the ACO models coming, we just really didn't feel that we had the infrastructure nor enough services really to be viable. So we looked around at some potential partners, and we landed on Abbey Community Mental Health Center up in Cedar Rapids. I had worked with their management staff for a dozen years, a very similar mission. What was probably different between us and Abbey is Abbey's a lot bigger than we are. We now, as a joint agency, we're probably the biggest community mental health center in the state of Iowa, if not the biggest, one of the biggest. We now serve 9 counties. We serve about 17,000 people a year. The nice thing about Abbey is we really now can provide a continuum of services. with our affiliate agencies. We have the traditional services that all community mental health centers really provide: psychiatry, psychotherapy, community-based services, outreach services, PATH, our school-based services. But by joining Abby and the affiliates with Abby, now we have Chatham Oaks that we're affiliated with. We have Pathways that are affiliated. We have Aging Services in Cedar Rapids. So we really feel that we got into a larger agency with the infrastructure that is really needed to run a behavioral health care organization. Plus, we have many more services that we can offer folks. So it's been kind of interesting being part of an agency that's really big. We now have served clients that have lived in Cedar Rapids but have chosen to come down to Iowa City to get their services. Now it's much more convenient for them to be in Cedar Rapids and get those services there. So it's one big agency that anybody that would want to be an Abby client can be seen in Amana, our Amana Family Practice Clinic, all the way up to Benton County, all the way over to Tipton, in all the 9 counties that we serve. So there is a sense that we can serve more people all under one roof. The management, many of you know the management team changed a little bit at at Community Mental Health Center for Mideastern Iowa. Sherry Zastro, that worked for Mideastern for, I think it was 75 years that she worked for us, did choose to retire, but myself, Teresa Ulrich, and Linda Hobart are still on board, and all of us serve on the management team out of the Abby Community Mental Health Center team up in Cedar Rapids, so there is some real continuity. One of our board members, Herb Musser, who served on Mideastern for several years and was instrumental in the merger, continued to go forward onto the Abby board. So there is still one of our board members that is serving up there. So there's a good continuity of care, and certainly the Abby board has certainly appreciated Herb bringing the Iowa City perspective forward. So we serve we're doing pretty much the same stuff that we always did with many of the same providers. Really only the name has changed and the location has changed. We were on the corner of College and Van Buren for 40 years. Like I said, we were in 4 buildings. Not the most efficient way to run a business, particularly when they're older buildings. So our board, again, with foresight, said it would be much more efficient. It would probably be better for the agency to get in one building so all the services are together. Anybody that was at our old buildings, you'd come into one building and you'd say, well, I'd like to register for services. And we'd say, well, you need to go back out the door, you go down the steps, you follow the brick path, and there's a building behind us. And that's where access to care is, if they're there. It wasn't the best way to do business. If you want to see the psychiatrist, well, you have to go outside again, go down the sidewalk, go up the stairs, and go up more stairs to get into our building to see the psychiatrist. Not a very good way to do business. So now we're at 1039 Arthur Street, over in the Town Crest neighborhood, one building with an elevator, all ADA compliant, where all our services are under one roof. So as Stephen goes in, walks in the front door, wants to register for services, he gets everything under one roof, and we don't have to send him on a goose chase trying to get services. I wanted to talk a little bit about where Abby and where Mideastern and where we see ourselves going, and then I kind of want to segue smoothly into Brad's presentation. As you know, and as the individuals that we've served over the years have really helped us understand that you really can separate this from the rest of this. And we know that people with a serious mental illness diagnosis die 25 years earlier, not because of suicide, but because of health care. So in the past year and a half, past 2 years, mental health centers have really made the decision to become part of the healthcare landscape. We need to serve the whole person, and we really want to bring our expertise and our experience to the healthcare world. Some of the things that we really feel that we can bring to that is, how do the social determinants of health really affect the individuals we serve? How does housing affect them? How does employment affect them? How does school affect them? How does their health care affect their overall recovery? And that's where we've really made a significant move in our organization, and that's where we really see ourselves going, particularly in Iowa with the modernization of Medicaid. All the dollars that we really get anymore come from Medicaid. We used to have a contract with Johnson, Cedar, and Iowa County, had a contract with the region, and for the most part, what those funds funded, psychiatry and psychotherapy and CSP services, have really been eliminated. So we are really a Medicaid-funded organization serving people with Medicaid and Medicare. To do that, you really do need, well, from our perspective, we really decided we needed to be much more aligned with the healthcare organizations. So now when you come in to our new building, and you can ride the elevator up, check in, before you see our psychiatrist, we now run you through the regular operation that anybody does that goes and sees a primary care physician. What's the first thing they do after they get your insurance card? They say, well, let's go you back, get you, see the nurse, take your height, your weight, get your vitals, talk to a nurse first about what do you want to talk to your doctor about, and get you prepared for that visit. So in our new building, we have a vitals room that's all private, so those vitals can be taken care of. You have an opportunity to meet with a nurse, and then the nursing practice is a very significant part of how we feel that we need to take care of individuals. In addition to that, a year and a half ago, 2 years ago?
Just over 2 years.
Just over 2 years ago, Magellan, many of you may have heard about Magellan, was an agency here in the state for several years, which is, well, they disbanded, and now all the Magellan workers are now are working for the other MCOs in town. But they chose us out of a variety of other entities here in Iowa City to become an integrated health home. And the model of an integrated health home is really to have an organization that will help integrate the health of the individuals we serve with their primary care or with their behavioral health care. And really paying attention to the individuals that we serve are complex, courageous, resilient folks that need some coordination of care to ensure that they get good care and continue in their recovery process. So that's what Brad is in charge of, and has a team of 13 now that act as integrated health home care coordinators. So I'm going to be quiet and turn it over to Brad.
So so my name's Brad, and I came to Iowa City as a student back in the late 90s and studied psychology at the University of Iowa, then went off to Australia and got married as a study abroad student and ended up living there for 10 years. So I've only been back here in Iowa City for a couple years, and I've been with the center since 2015 in March. And so it's been a lot of change personally and professionally. It's been pretty exciting. And integrated the IHH, so it's integrated health home. It's not an actual physical location, but it's a service. Has been through a ton of change. Like our program has been through a lot of change since it started. I started in March, there was a merger in July. It's a new program, it's evolving, and it's a very exciting program. I think it's got a lot of real positive benefits to it and a good future. So it's not a physical location, so it's a service, and it's a statewide initiative, so every county in the state of Iowa has an IHH that oversees it. Our team serves Johnson, Iowa, and Cedar counties, but our entire IHH covers 9 counties in eastern Iowa, so Lynn, Benton, Jones, Delaware, Fayette, and Buchanan. So essentially an IHH, Integrated Health Home, is a team of healthcare professionals. We have so Stephen mentioned we have 13 staff members. We have 3 different types of individuals involved in the healthcare coordination. So we have specific care coordinators, which would be similar to case managers. We have 2 peer support specialists who have lived experience with mental illness. And we have a nurse care manager, so a psych nurse as well. So the care coordinators, their primary job is linking we call our clients members of the health home. And so they link members into healthcare resources. We help link people with primary care providers, psych providers, therapy, dentists, and supported community living services. Our nurse does a lot of health education. She assists with medications and outreach into the community for our members. And our 2 peer support specialists, they share their recovery journeys with members. It's a little more of an informal and mentoring kind of relationship. And they also facilitate 2 groups that we have on a weekly basis. So we have an activities group, and we also have a breakfast club, which is a social group at the center on Tuesdays. So eligible members for IHH are adults living with chronic mental health conditions and in possession of Medicaid benefits. So full Medicaid is required. So as I mentioned, it's a very person-centered approach to the care coordination. So we're increasing preventative care and assisting with medication management, looking out for those gaps in care, because a lot of our members we find don't see a primary care doctor regularly or don't have a dentist, so we're helping out with that. Accessing community resources, socialization, overcoming transportation barriers, assisting to find volunteer opportunities and things of that nature. A big part of what we do is helping our members to access funding for supported community living. So we've kind of taken over a lot of the case management that Johnson County used to do. And so we help with everything from rehabilitation to SCL services and individuals living in HAB homes. And we also do a lot of work with transitioning individuals who've been in the hospital back to living in the community, or if they've been in a residential care facility, back to their homes as well. So yeah, big emphasis is on increasing regularity of primary care visits, yearly flu vaccinations, assisting members with getting to appointments, medical and psych appointments. It's a very person-centered approach, so we're very flexible in our activities with the members. We have, at this point, with 13 staff members, and we have 500 clients that we serve in the 3 counties, Johnson, Iowa, and Cedar County. And our entire IHH actually serves 2,500 individuals, so we're the biggest IHH in the state, even bigger than the ones in Des Moines.
2,500 people, you say?
Yep. And growing. Our team here in Iowa City, our membership's grown since I've been here in the last year. I think it's increased by 33%. So there's a lot of need out there, and we're doing a better job of finding, locating the individuals that need the help. So it's pretty exciting times.
So the 9, you said 9 counties?
Yep.
You mentioned only 3.
Our team here in Iowa City, we cover the 3 counties, but we have, it's kind of broken up into like 3. There's the Abbey North IHH team, there's the Abbey Central that covers Lynn and Benton, and then we're the South team, the South side.
It's the same organization?
Same organization, yep.
So are you here?
Yep. I'm located at the 1039 Arthur Street address, yep. Yes. Oh, please, I prefer Q&A. It allows me to be more natural.
Okay, so you see the clients in their homes.
Yes.
Is it?
Yeah.
Okay, thank you.
Yeah.
I was having
Yep.
trouble with the word home. I kept thinking you were.
Oh,
No,
yeah.
okay, all right.
Yes, yes, we do. But the care coordination activities aren't just. I mean, we visit individuals in their homes, but also it's over the phone. We do a lot of coordinating over the phone and out in the community. And people come to see us as well. Our two social groups. One of them is the Breakfast Club on Tuesdays, and so we actually have a cooked breakfast, games, and just community kind of socialization at the center. And then our Thursday activities group is oftentimes our peers will take our members out. They'll go to Mercer Park and they play pool and bocce ball and basketball and different things like that. So yeah, at the center, out in the community, in people's homes, wherever people need us to be. At the hospital, we're at the hospitals a lot. Yes? Oh, sure. I appreciate the questions.
I have a couple of questions. Where did the name Abby come from? And second question is, in addition to funding from Medicaid and Medicare, is there any federal or state funding? And is that funding, are those sources the same for Iowa City as the original Abbey? Are they the same as before you merged as for Abbey?
Yeah, sure. I'll take the second question first. Yeah, it's the same. It's the same Iowa Medicaid funding for all of IHHs, and so it's the same since the merger. And the name Abbey, I believe, comes from believe it was the name of a settler in the Cedar Rapids, Linn County area. Does that sound right to you?
Mm-hmm.
Yep. And that's where the name, the Abbey Center for Community Mental Care, the old Abbey Center, the Abbey Health, and there's a lot of different Abbey names out there. We're the Abbey Center, then there's Abbey Health, which is the umbrella organization, so, yeah.
And it also came high in the phone book for folks that remember what phone books is. So when you looked it up, Abbey came very high in the alphabet.
So I have a few questions. I'll just rattle them off and then you can. So do you help people apply for Medicaid and Medicare? Because sometimes when families are, have discovered their loved one has mental illness and they're trying to figure out the system, what's your waiting list? And is there any time that you, quote, kick people out? What behaviors? And then your address on the handout is, are you still at East College? Because you're at.
You know what? I'm sorry. I think that was an old brochure that may have been attached to the new ones.
Oh. Okay.
Yes. Yeah.
Okay.
Apologies for that. So for the people whom we serve, full Medicaid benefits are required. So we never kick anybody out. Sometimes when people do lose their Medicaid, they lose their eligibility for integrated health home. But if I get a phone call from someone and they have a loved one with a mental health condition and they need help, I would usually refer them to the East Central region. They can usually help along.
There still is a region.
Yes. Yeah. Yeah. Yep. They're wonderful. They do a great job.
Can you explain the difference between the region funding and Medicaid funding? Because that two different pots of money, correct?
Yes. I guess I can I'll speak about how it works with IHH, and then maybe Stephen can elaborate a little bit more on that. But the region's really wonderful in initially setting people up with services. If they don't have Medicaid, they can help them with that process of gaining the eligibility that they would be needed for IHH. And so often what our work with the region is they'll set people up with services and then refer them to us once the Medicaid's active, or if they have, say, Iowa Health and Wellness Plan, there's a way to get full Medicaid benefits through them, and they help with that. And once that's in place, so they'll help people get the services, they'll short-term pay for it, and then the individuals for the more long-term are moved on to IHH, and it's what's called HAB funding, which is that Iowa Medicaid. Yep. Does that make sense?
I know what it is.
Okay.
I was asking because people really reach
Yeah, yep.
And where is the East Central region located?
Johnson County Administrative Building on Dubuque Street. I think it's 855 South Dubuque Street.
For the whole region?
Well, there's different offices. I know there's one in Cedar Rapids. The local, that's the local office. Yeah.
So that's still our case managers that
Mm-hmm. Yep.
work for the region?
Yes. Yeah.
We have a Thursday night support group here for families that are searching for support for their loved ones. And so many of them are older people who have tried to keep their people safe and have been tried over and over not to try to find a way to get support systems. And oftentimes they've gone into the system under substance abuse and find that mental illness is also part of it. So that's what we're finding more and have found more here in our Thursday night support groups. What's going on with the dual diagnosis people?
Well, it's easy for me to speak more just about IHH and how we work with individuals, but the funding that we're provided is called habilitation funding. These are for the individuals that need more intensive services, let's say. And it's actually, the way that it's been sort of rolled out is a very broad definition of what makes one eligible for that type of funding. So a mental health condition for 6 months or greater is sufficient. So the issue of dual diagnosis doesn't really come into play as long as there is a mental health condition there.
Okay. And then I like to clip out newspaper articles. And this is by Bob Lincoln. You may know Bob Lincoln. And he says, fund a mental health system. We cite tragic example of challenges because of, and this was just in today's paper, I believe, inadequate and ineffective mental health services throughout Iowa. Proposed legislation in the Iowa Senate will complete the critical funding, but we're talking about redesign here, he says. And in the historically, Iowa has relied on counties to fund and provide mental health services, as we know, primarily through property tax. And then they put in the 1996, the cap on mental health spending. So he is recommending that we have Senate File 2318 eliminating the 1996 property tax cap, and I know Steve knows all about this, which will allow regions working with county boards of supervisors to provide sustained funding necessary to respond to mental health needs. Now he's in a rural county, and he's really speaking for rural counties, and he said they cannot do it. They cannot survive the way this has all been set up. And he said Scott County, Johnson County, and Polk County are doing okay. But what is I know you have a lot of experience in all this. He says we need to have long-term funding to move toward adequate services for its citizens. Passage of Senate File 2318 is the right thing to do for the state of Iowa and the right thing to do to address the needs related to mental health. And this was also in the Iowa Today in legislate. County skeptical of new plan to fund mental health. Do the two of you have answers? You go to a lot of meetings, I know that.
Well, I don't see a coffee pot on, because if we're going to start talking about Senate File 69 and we're going to talk about mental health tax levies, I think what Bob is talking about, as you all know, the illness, the disease, the condition that we're all familiar with has been the least funded, the least supported of all the illnesses. That certainly the persistent mental illnesses. So I think as you look at the bill that Bob is referencing, there is certainly a lot of support for a lot of organizations throughout the state to remove the hard dollar cap off that levy. And really in counties like Johnson County and Polk County, they're really the ones with the most difficulty, because the mental health tax levy, which is the levy that you pay to the county out of your property tax dollars to pay for mental health services, was capped at the 1996 level. So whatever Johnson County was levying and paying for services in 1996, the state legislature said you cannot levy any more than that. Let's see, quick math, that was 20 years ago, right? 1996. So what's happened to the population of Johnson County? What's happened to the population of Polk County? What's happened to the population of Scott County? The population of all those counties has risen, but the amount of dollars that those counties can levy to pay for mental health services and now to funnel to the region have been capped. So this legislation is saying, take the cap off. If a county wants to raise that levy to increase the funds that they can pay for mental health services, each county, which Iowa has a strong home rule perspective, counties should be allowed to do that, not to raise it above $47.28 per unit, because some counties levy a lot, some counties levy not very much. So I don't know if that's the solution, but it's certainly one being put forth. I think as we look, as the managed care companies roll out, and as we look at how Medicaid can really fund all health care, including behavioral health care, the funding issue is still going to be a challenge. So I don't have the answer for you, June, on that one. But that's what that legislation is about, is essentially saying the levy doesn't need to be capped anymore. Farm Bureau says that's a tax increase. If you look over the state, it's probably revenue neutral.
I have one more thing to mention here that my friend just handed to me. Waiting lists. How soon may a person be seen who has asked to have?
Where's the waiting list process? Yeah.
Yeah.
When they go out there to Addison.
All the way out to 1039 Arthur Street, further east. To see, let's see, we just looked at this at management team. I think to see one of our psychiatrists, we're running about 3 to 4 weeks compared to 6 months at the university. To see a therapist, you can be seen within the day. As of, is it around May 1st, we're doing same-day access? May 1st, we're going to change our access process to a model called same-day access. So you walk in the door and you're seen by a clinician that day, which will start May 1st or the middle of May. Still, as you all know, I'm not telling you anything you don't know, we rank 49th in the state, in the country, of psychiatrists per capita. There's about 236 psychiatrists in our state of 3 million. We have recently, as part of ABBY, engaged a telepsychiatry firm. So we have 2 psychiatrists that come in via the internet. One comes from Florida. One comes from Arizona. And the nice part about this is that we have the capacity that now when we contract with these psychiatrists, they can actually see people in any of our 9 offices. So if there's an opening in our Independence office, we can just switch the camera to the Independence office and that person can be seen there, as opposed to driving a psychiatrist up from the Cedar Rapids office or from the Iowa City office. It takes, an hour at any rate. Now it's just the flip of the switch. We pull all the individuals that see our psychiatrists the telepsychiatrist, 82% say, really, I don't see any difference between a face-to-face psychiatrist and the psychiatrist over the screen. Get the same service. I feel heard. I feel listened to. So this is really kind of one of the trends that we're really seeing, because there just aren't enough psychiatrists available, is using telepsychiatry, and we've gotten really good feedback from the individuals we serve. We're very fortunate to be bringing on an advanced registered nurse practitioner to the Iowa City office full-time. Finishes her training up this spring, and with the licensing and the boards, she'll be on board probably the end of August, so she'll be here full-time. In addition to that ARNP, we have a child psychiatrist, Nancy Byer, who's with us 20 hours a week. The telepsychiatry is 1 day a week, and then we have a variety of moonlighters that from the university that are in their training that come and work with us Wednesday night and Saturday. We're open every Saturday morning now from 9 to 12. We rotate from our clinic and the free mental health clinic. And then we're also a community psychiatry residency site. So we bring between 4 and 6 residents who do a 6-month rotation at the center. We bring about four or six at a time. So we're helping training the new crop of psychiatrists as well.
So are all these people on your staff?
Yes, ma'am. Pretty impressive, huh?
One of the categories you spoke of, I mean, like, are some of them residents?
Yeah, so, residents and moonlighters. Yes, ma'am. She was just asking about all the names that are listed on the psychiatric team.
Just one more thing here, then I'll relinquish this. The VA, I know, has just worked for so many years, it seems like, with the telepsychiatry, and they had so much trouble. I don't know if you're having this at all, but there had to be a registered nurse in the room when the telepsychiatry was going on. They had to have a person there that was had a certification to be able to be with the patient and the psychiatrist to maybe do interpretation or to write notes or whatever. Do you have problems with having a certified nurse there in the room with the telepsychiatry going on?
We really have to lasso her and drag her into the room, but after that, it's okay. No, I tease. We're very fortunate to have a registered nurse on staff. We're not required to have a nurse, but we feel practicing good medicine, you need to have a nurse available. So Ginny will often be available, is always available, sometimes meets with the client and the psychiatrist, sometimes doesn't, but is always available to the psychiatrist from Arizona or to the patient. So that hasn't been a challenge for us.
But you're not required. That's amazing.
Well,
Because
we're not.
that was part of the oversight. Okay.
Oh, we
Not part.
make our decisions to practice in a way that we feel serves the individual best, and that's a nurse. Yeah.
Okay, with the residencies, I go to the University of Iowa Psychiatry Department. I get a new psychiatrist about every 3 months. Is that so? Do your patients have that kind of turnover, or
If the individual that we're providing psychiatric care sees a resident, they get a faculty doctor, as you're familiar with, and our residents turn over every 6 months as opposed to 3 months. So yes, it's a training experience. Some folks that we serve appreciate that opportunity to see a new psychiatrist. Other folks really see it disruptive to their care, and that's why when that occurs, then we would say to that individual, well, you could see Eric, who is our telepsychiatrist, It wouldn't be a switch over every 6 months. Or you see one of the Moonlighters, that it wouldn't be a switch. Or we're very excited about bringing the ARNP on, who there wouldn't be that rotation going through. But we certainly realize that that's one of the challenges for individuals of having to retell that story, establish that relationship on a rotating basis. And it's the challenge of how do you provide psychiatric care when you're the 49th state in the nation in psychiatric care. So yeah, it's not every 3 months, every 6 months.
Well, I'm not sure it's 3
Yeah.
months or 6 months, but.
Yeah, the rotations are generally 3 months, and when we were talking with the university about being a residency site, we said we don't want them for just 3 months, we need them for 6 months, and we were able to work that out with them.
A couple of days ago, I drove by the old location on College Street, and there was a sign there that said Community Mental Health Center. Do you still have some functions there?
Nope.
Just forgot to take the sign down?
Yep. It's a good reminder.
What's happening to the building?
We sold the buildings, and I'm not quite sure what's going to happen to the buildings.
There's something I'm disconnecting on. If you are getting your income from, most of your income from Medicaid and Medicare, okay, if you're getting most of your income from Medicaid and Medicare, what does the cap? I mean, it's not capping Medicaid and Medicare funding for you. What is it that our state is not getting that other states are getting?
Donna, these are county funds. It's county. If you go way back when June's hair wasn't white and I had hair, what funded community mental health centers in Iowa was property tax dollars. There was no state money involved, no private insurance, no Medicaid, no Medicare. It was just county tax dollars. When, as June refers to Senate File 69 in 1996, the counties said, we want some property tax relief, and the state said, okay, we'll give you some state dollars. And I won't go into all the sordid details because smoke will come out of June's ear if we talk about this too much. But in that arrangement, the state said, we'll give you some state money, counties, but you cannot levy a county levy any higher than what you charged in 1996. So those are county dollars. That's no federal money. And as Brad said, the East Central region is now a funding source to help get people started until they can get on Medicaid. They're funding emergency services. They're funding a variety of programs throughout the region with your property tax dollars. What they are not funding, which they traditionally did, the counties traditionally funded, was that fee-for-service psychiatry and psychotherapy services that we contracted with them to do. So now all of that comes from Medicaid and Medicare. Does that make sense? Okay.
So then our property tax dollars for mental health are funded the regions or the county?
The county, all 9 counties in our East Central region threw in together to form the East Central region, and then they put their MHDS money into a bigger kitty.
All of it.
So it's, well, yeah, give or take. It's about $12 million.
So there's nothing really unique to Johnson County now being funded out of that money. It's a region.
Yes, ma'am. That would be the easiest answer to that. Yes.
I wondered what happened to the regions that just disappeared.
No, the region is still there.
We need some publicity.
Okay, another question?
a very general question, and it's kind of for both sides of the table here. I mean, we as NAMI, you as Abby, are there things that you can see right now that NAMI and Abby can do, I don't want to say a partnership, but together to promote the awareness, the education, the advocacy, the support that are our NAMI goals?
Yeah, I think, you know, you are probably the strongest advocacy group in Johnson County for individuals with lived experience of severe and persistent mental illness. I think statewide, NAMI is also probably one of the strongest advocacy groups for this population. I think as Abby goes forward and continues to align itself and position itself to be a healthcare provider, I think one of the partnerships that the two entities can engage in is really working to move the focus of our work to a recovery-oriented paradigm as opposed to, oh my God, somebody's got mental illness, that's all she wrote. And being in the game a long time and never being accused of being bright, I think the thing that I have learned by working with your loved ones, working with you, is the resiliency, the courage that you all show as parents and individuals with that lived experience of moving to that perspective of we can be in recovery, we can regain our lives back because we're a resilient, courageous group. And I think as Abby makes the move more into healthcare, we can partner with NAMI to talk about really the recovery movement, and what's so important, as you all know, is that family support network that individuals need to have. Stephen can go see one of our psychiatrists and get the best psychotropic medication in the world and take that medication just as it's prescribed. They can be in Brad's integrated health home and get all those services and those funding. They can go to the social groups and they can go to therapy, but without that support of a family or without that network in the community to really have the courage to do the hard work, we're kind of pounding sand down a rat hole. So I think what NAMI has done with our place, I think what NAMI does with the classes that you do, with the family and the peer-to-peer, are really significant. So I think as Brad's team is working with peer support specialists, I think it would be some things where we'd want you in our house doing some of that training and working in those areas. So now I don't have a real specific thing, but more in that area of recovery, and talking about this work from that perspective, I think would really be important. Nice segue. Other things. You got to ask another question of Brad, like, how did he get to Australia and how did he come back?
It's interesting, actually. In Australia, the recovery model, like the state that I lived in, the state mental health system uses the recovery model of mental health as their basis, which is pretty inspiring stuff, actually. But I came back here because I love Iowa City. I think it's a great community, and there are a lot of resources available, and it's a wonderful place to live. A lot of caring people here.
So we have an international perspective at Abbey. We have staff from Australia, we have staff from Belgium, we have staff from France, we have staff from Turkey. So we really are beginning to be a much richer and robust agency. So we really appreciate the opportunity to come and talk with you, and I think as we look forward to continue this partnership and continue to spread the word, that it really does take a community to stand up, put their shoulders back, welcome individuals with lived experience of mental illness. Two of my wife's cousins were recently diagnosed with pancreatic cancer. So we were out at the farm this week, kind of getting the family together and being supportive. And I just kind of wonder if those two cousins had been diagnosed with schizophrenia, if those two cousins had been diagnosed with major depressive disorder, if those two cousins had been diagnosed with bipolar. I just hope to goodness the family would rally just as if they had been diagnosed with pancreatic cancer. That's what we kind of need to level the playing field. It's a very recoverable, lived experience with the support and with the good care. And I think that's really what the integrated health home is really bringing to the table that we didn't have before. We had kind of isolated, siloed services. Integrated health home is really leading the charge throughout the state in really bringing the body and the head together and really bringing all the providers together that are providing those services for you and for the individuals that you care about.
I hope that you refer your families to the family-to-family program that NAMI puts on. You do? Oh, good, because as a family member, that program gave me more information and gave me more to hold in my hand about how to deal with my two sons with serious persistent mental illness, and allowed me to have a life in addition to supporting them. So family, I can't say enough good about family to family, and so I'm glad that you do give information about that. Thank you.
I know you can't hear me, so maybe you can. Two questions.
People can hear you.
Okay, thank you. Yeah. I had two questions. One is, a person who needs intake, do they go to the regions or to you, or can they choose? Where do they go first?
What's the next one, Carol?
The next one is, does your budget consist only of Medicaid reimbursements? Or do you have some other sources too?
A good place to start, Carol's question was, if someone wants to get services from Abby in Iowa City, where should they come first? The first place they ought to come to is us, and come to 1039 Arthur Street, and they can talk to our Access to Care staff. Our Access to Care staff probably has combined 40 years of experience in working with hooking people up with funding sources to fund their services. So this is a good place to start, coming to the center, coming to Access to Care to get the process started. And as Brad said, we may refer Stephen to East Central Region for some short-term funding to pay for those services until Stephen can get another funding source attached. So ours would be a good place to start. We'll need to get some funding attached so we can begin services, but it's a good place to start. We have our Access to Care team, and then we also have the integrated health team. Yeah?
Yep. Yeah. Oh, yeah. I'm pretty good at screening and checking eligibility.
They're often qualifying for Medicaid, there's no service, then how do they get services?
East Central Region will do that short term, and by short term, Stephen, we will fund you for services at Abbey as long as you are pursuing other funding opportunities that you would be eligible for. And the second question, most of our budget now does come from Medicare, Medicaid. We're a United Way agency as well, so we're funded from United Way. We do have we have a couple federal grants, and then we also take every private pay insurance known to mankind as well.
You still do annual fundraising?
And we still do trivia night, and we still do annual fundraising.
What about direct mail?
Direct mail, that will be back on my plate soon. Yep.
Okay, I just took peer support specialist training. So what exactly do your peer support specialists do?
Yeah, they meet with various members one-on-one. Yeah, and meet the clients where they're at and do all kinds of things from socializing to exercise to.
Yeah, one of my issues is I'm no longer allowed to drive. So that would be a major problem to employment at your agency, wouldn't it?
Unfortunately, sorry. Everyone needs to be able to drive. Yeah, because we're out in the community so much. Yeah.
Any other questions for our presenters here before we wind down? Okay, well, thank you both very much.
You're watching City Channel 4. On TV, online, on demand, on Facebook, and now on the go on your mobile device.